السلام عليكم ورحمة الله تعالى وبركاته. I'm Dr. Gorashi, oral maxillofacial surgeon, and this is Dental School Echo Samaha. We are going to proceed our lecture in principle of oral maxillofacial surgery, and this is our lecture about suturing material and technique, and we're going to continue in principles of suturing. In every process, you should have principles that guide you thoroughly to have a successful procedure. So in suturing, you should firstly know that the needle should be grasped approximately the distance from the eye and 2/3 from the working end, like in the below picture. If you are following, the needle itself is divided into two parts. The third part, which is near to the eye of the needle, and the 2/3 part, which are in the working end. So the needle should be grasped from this area. This will make it easy to manipulate and enter into the tissue, and will prevent its breaking and its distortion. Number two, the needle should be enter the tissue perpendicular to the tissue surface. As you see in the second photo, it should be perpendicularly 90 degree. And when entering the tissue, it should go smoothly with its curve. The needle is curved, so you should go with the curve, and it's just like you want to do a full circle by the tissue, by the needle. So number three, the needle should be passed through the tissue along its curve. And this is just like in the picture below. Number four, the suture should be passed at an equal depth and distance from the incision on both sides. If you look to the picture below, the entrance and the exit of the needle should be at the same distance and in both sides of the wound. And this would be suitable if it's 0.3 or 0.5 centimeter away from the wound itself. So by this, you can prevent the tearing of the flaps. Number five, the knot should never lie on the line of the incision. It should be in one side, not in the center, because in the center the tissue, the wound may collapse, and the tie itself may accumulate bacteria and evoke the tissue and make infections. So the knot should be in one side and not in the center. Number six, the needle always should pass from the movable tissue to the fixed tissue, because by this means you can grab and stretch the tissue, the mobile tissue, but the fixed tissue is not mobile, and you cannot stretch it with you. Number seven, the needle always passes through the thinner tissue to the thickest tissue, because the thickest tissue is less mobile, as we say. If you following the last principle, you want to grab the mobile tissue first. So the thinner will be more mobile and more flexible than the thicker tissue. Number eight, the tissue must never be closed under tension, because if you close the tissue under tension, you will risk the blood supply to the area, and you will end up by non-healing of the area, or if it heals, it will heal by scarring and leave an ugly wound scar. Number nine, the suture should be tied only to approximate the tissue, not to bleach the area and cut the blood supply. So you want to just approximate the two sides, and the body will do the rest of the healing by itself. Number 10, the suture should be placed at greater depths than the distance from the incision. When you increase the depth, you will make sure that a larger area larger contact of the wound, and then a proper healing of the wound. And you can also invert the wound surface or the wound edges, and the inversion will help in approximating the deeper tissue and produce a good healing. Number 12, the suture on the skin are usually removed in 5 days, and intraoral suture in 7 days. This is in case of non-resorbable sutures. And if there is tension while suturing, the suture may be kept for 10 days. After this, as we say, you will end up either by inclusion cyst or by railroad scar formation. So after finishing the principle of suturing, you should know the type of knotting for each suture. The first and most common type is a square knot, but we are talking in general. The surgical knot tying is vital to the art of suturing. It's essential for knot security and to prevent untimely knot tying, because if it's untied before the wanted time, you will end up by breaking the wound and non-healing of the wound. A knot can be tied using an instrument like needle holder or by hand, or you can use combination of needle and hand. Okay, the first type of knot is secure square knot or reeve knotting method. Once you tie the knot is completely and totally secured. There should be totally 4 throws, and you should end it by a long cut. So the main idea of the square knot is by using when you're using needle holder, you should have the first one clockwise, and the stretching of the suture would be the opposite side. So if you start in the right side, you should stretch or tie the knot the next in the other side, and the second tie would be the opposite. I know this is difficult to imagine, and because of this, you will find link for video for the square knot in the description box. It will show you how to use it properly or tie it properly. The picture is showing you the final view of the square knot. The second the knot is the surgeon knot. It's formed by throw of the suture, double throw of the suture, or two throw of the suture around the needle holder on the first tie, and one throw in the opposite direction is the second tie. I also put a video for you in the description box so you can see how you can properly do this. It's suitable for the synthetic sutures. The picture is showing you how to do it, but I know it's difficult to imagine. But in the first picture, it's the double throw, and then you will open your needle holder and grasp the free end of the suture and do your tie. This will be the first tie. The last picture is showing you just single roll around the needle holder, and you will also grab the free end of the suture and tie it. I think it's very difficult to imagine this, and you should watch the video to know the proper technique, but you should know it's perfect for synthetic sutures. The third tying knot is the granny knot or slip knot. It's suitable for silk, chromic gut, or plain gut suture material, and all of this material, as you know, are natural materials. So the granny knot is suitable for natural materials. It's formed by a tie in one direction, followed by a second tie in the same direction. It's different from the square knot. The square knot, you're doing a tie in direction, and the second tie in the different direction. But the granny tie, both ties are in the same direction. It also contains a third tie in the opposite direction. As you see in the photos, the first one will be a single throw around the needle holder, and you will grab the free end, untie it. The second throw will be two throws around the needle holder in the same direction, and you grasp the free end and tie it. And the third one will be in the opposite side or opposite direction. It has also a video in the description box. You can know the proper technique. So after knotting your knot, you should know the suturing techniques you're going to need. And this is depend mainly on the type of the wound you are, type and size and depth of the wound you are going to suture. So if you have a small suture, you can use a specific technique. If you have a larger suture, you have a different technique. If you want to suture a deep layer, you have known technique. If you want to suture a superficial layer, you have a different technique. So you choose your technique according to your wound needs. The first most common, most known, most secure, most eligible technique is the interrupted suturing or sling suturing technique. It's the most commonly used suture. The suture is passed through both edges at an equal depth and equal distance for the incision. As we say, it's 0.3 to 0.5 from the wound edges, and the knot is tied with whatever type of knot tying you want. Either you use a granny or a square or surgeon knot. You can use whatever knot you want, but the main idea of this suture, as in the picture, if you are following the below picture, you should enter the needle same depth and same distance in the wound edges. It's a single interrupted technique. Its advantages that it's strong and can be used in area of stress. The second advantage, it's successful. Its successive suture can be placed according to the individual requirements. So if you have irregular wound, you can use it easily. You can use one here and one there, and without restriction, because it's a single individual technique. Number three, each suture is independent, and the loosening of suture will not produce loosening of the other sutures. So if you want to remove one, the other sutures will not be affected. Number four, a degree of aversion can be controlled. The degree of aversion can be controlled. As we say, we know we need degree of aversion for the wound edges, so to ensure maximum time of the or maximum approximation of the wound edges. Number five, if the wound become infected or there is hematoma formation, removal of few sutures may offer a satisfactory treatment because, as we said, every knot or every suture is individual and depend on itself. The second technique is continuous over and over suture. I think it's obvious from its name. It's not individual. You are going to suture the whole wound and by using a single suture and single knot. You're going to do many sewing, but at the end you are going to have a single knot. like the picture below. You should usually use it in long wounds. It's rapid technique for closure and disrupt the tension uniformly over the suture. Those are the advantages of this technique. Rapid and this the tension will be uniform at at all suture line. It's also offer more water type closure, and this you are usually used in area where there is so many fluids like oral cavity or abdomen or these areas, because you don't want any fluid leak after your suture. A simple interrupted suture is placed and the needle is then reinserted in continuous fashion. So you started as you are want to do interrupted suturing, but you are not doing your tie. You're going to complete the whole wound and then doing a single tie at the end. So in this technique, if you have a hematoma and want to decrease the pressure, if you cut just a single suture, you will lose all your suture. So it has so many disadvantages, but it's also so beneficial in so many areas. So the third type of suturing technique is continuous with lock sutures. It's similar to continuous suturing, but locking is provided, and this is done by withdrawing the suture through its own loop. If you're seeing the below photo, you are doing like interrupted suture, and when you are pull the needle outside, you insert it inside the loop. So by this you are doing a lock, and it will leave the wound more secured from slipping of the suture. The first type of suturing technique is the mattress suture. It has two types, either horizontal or vertical mattresses. They are used in area where tension-free flap closure cannot be accomplished. Mattress suture are used to resist muscle pull, invert the wound edges, and to adapt the tissues flap tightly to the underlying structures. The mattress sutures are usually used when you need more strength in the area. The first type is the horizontal mattress suture. The needle is passed from the edge of the tension of the incision to another edge, and again from the later edge to the first edge in horizontal matter, and a knot is tied. Simply, you are going to start it like you want to do an interrupted suture, and when you are getting to the other side, you do an interrupted suture for the second time, but you begin it from the last time. I don't know if you are following well or understand me well, but you'll find video in the description box to ensure that you know the technique. And if you look to the picture below, you will also have a clue about how you are doing it. The picture is showing you how to do how the thread enter and exit into the other side, and then you insert it in the at the end side and bring it, and then use whatever knot you want to close this suture technique. This suture provides a broad contact for the wound margins because it's going horizontally, and that's suitable for closure of extraction socket wounds. The second is the vertical mattress suture. A simple interrupted suture is placed, and then when the needle is brought back from the second flap to the first, the depth of the penetration is more superficial. This is used for closing the deep wound. If you're seeing the picture below, the entrance area by the arrows, the entrance area in this side, and you are going to the other side, and you re-enter the needle in front of the area, in front of the exit area of the needle, and get it to the other side where you begin your suture. The second entrance would be more superficial to that one, and you and we are using it in the deeper wounds if you don't want to do multiple sutures or suture in layers. You find the video in the description box. You can learn this technique more. The figure of 8 suture can be used in extraction socket closure, as well as for adaptation of the gingival papilla around the tooth. It's just like crossing suture. And we will all discuss all these techniques in more elaboration in our live session, inshallah. The last technique is subcuticular suture. It's cosmetic suture used in skin to give more pleasant look for the wound. It's using cosmetic result. The subcuticular layer of tough connective tissue is sutured with hold the skin edges in close approximation. We usually, after using the subcuticular tissue subcuticular suture technique, usually we use a glue, skin gluing, to have a better contact in the skin area. After you learn this the suturing technique, and after 75 days in non-absorbable suture, you need to remove your suture. Skin suture are usually removed after a period of 7 to 10 days, depending upon the area. The mucosal sutures are removed between 5 to 7 days. And as we said, if there's tension or infection or whatever, you can simply leave your suture for a longer time. We have other means to get the wound closed rather than suturing, and those means are ligating clips. Those are round clips used designed for ligation for tubular structures. They're not using we're not using them in head and neck area. They're most commonly used in abdominal procedure for ligature, let's say, of gallbladder tubes. The other technique is by tissue adhesive, and this we are using in oromaxillofacial surgery a lot. After tight closure of the subcutaneous tissue, the skin layer can be closed with the help of tissue adhesive, like M-butyl cyanoacrylate, which on tissue contact will polymerize into a hard substance that keep the wound margin together and prevent it from dirt, from bacteria accumulation, from water, and thus accelerate its healing. The tissue adhesive are usually used after you do suturing. So if you do a subcuticular suture, you can just put tissue adhesive after it, or if you do simple interrupted sutures, now you can also use the tissue adhesive to protect the wound and accelerate its healing. See this and this photos, dilated wound. They use tissue adhesive to have a better cosmetic results. We have also have surgical staples. Skin staples are made of stainless steel and are placed uniformly to span the incision line. They have minimal tissue reaction, as you see in those photos. Actually, the first one is for removal. No, the first one is for applying of the staples, and the second one is for removal. Each one of them have its specific device. It's very rapid, very clean, with very acceptable results. But it's slightly more expensive than using regular sutures. The last one is Dermabond topical adhesive skin adhesives. They are non-toxic, they are flexible, they are transparent and waterproof, clear dressing, resulting in excellent cosmetic results. These adhesives is applied to the dry skin over the wound by a proper technique in multiple thin layers. At least you do 3 layers. It sets within 3 minutes and offer sutureless skin approximation. It has 3-dimensional strength and is 3 to 4 times stronger than butyl cyanoacrylate. So the Dermabond is used without doing suture, and this is the difference between it and the skin adhesive. It's very useful and will give you a very beautiful result, and it's commonly used in facial wounds. So this is all about suturing and suturing techniques. For more information, you should follow the videos in the description box, and good luck. Thank you.